12 early signs of heart failure you shouldn't ignore. Heart failure is not just a medical term. It's a growing crisis. More than 6.2 million adults in the United States are living with this condition, and that number continues to climb every year. Traditionally thought of as a problem for older adults, heart failure is now appearing more often in younger people and disproportionately impacting minority communities. According to the Heart Failure Society of America's 2024 report, even more concerning, death rates in these groups are rising. The reality is sobering. The CDC reports that about half of those diagnosed with heart failure die within 5 years. But here's the hopeful part. Early detection can make all the difference. The body rarely shouts in warning. Instead, it whispers. Too often, people dismiss these signals as stress, fatigue, or just getting older. In truth, they may be early alarms for something far more serious. This video isn't about fear, it's about empowerment. We're going to uncover 12 early signs of heart failure that are easy to miss, but critical to recognize. They may not look like the dramatic chest pains you imagine, but they're equally important. By learning these signals now, you'll be better prepared to protect your health and take action before it's too late. Disclaimer: this video is for educational purposes only and should not be considered medical advice. Always consult a licensed healthcare professional with any questions or concerns about your health, medical conditions, or treatment options. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Shortness of breath on exertion, dyspnea. The most common early sign of heart failure is experiencing shortness of breath during activities that previously felt effortless. This condition, medically known as dyspnea on exertion, occurs when your weakened left ventricle cannot pump blood efficiently. As blood backs up into your pulmonary circulation, fluid begins leaking into your lung tissue. Initially, you might notice breathlessness when climbing a flight of stairs or walking briskly for several blocks. According to the New York Heart Association classification system, this represents Class II heart failure. What makes this symptom particularly concerning is its progressive nature. Activities that once felt normal become increasingly difficult. The mechanism behind this symptom involves your heart's inability to meet your body's increased oxygen demands during physical activity. When your heart muscle weakens, it cannot increase its pumping capacity effectively. This forces your respiratory system to work harder, causing the sensation of breathlessness. Research shows that dyspnea on exertion is present in approximately 85% of heart failure patients at the time of diagnosis. However, many people dismiss this symptom as simply being out of shape or attribute it to normal aging. This misconception can delay crucial medical intervention by months or even years. Pay attention to any changes in your exercise tolerance. If you find yourself stopping to catch your breath during activities you could previously complete without difficulty, this warrants immediate medical evaluation. Early recognition of exertional dyspnea can lead to treatments that significantly improve both quality of life and long-term outcomes. 2. Orthopnea. Difficulty breathing when lying flat. Orthopnea is the medical term for shortness of breath that occurs specifically when lying flat and improves when sitting upright or propping yourself up with pillows. This symptom typically emerges in more advanced stages of heart failure, usually corresponding to New York Heart Association Class III or IV disease. The physiological mechanism behind orthopnea involves gravity and blood volume redistribution. When you lie flat, venous blood from your legs and abdomen returns more rapidly to your already weakened heart. This increased venous return overwhelms your left ventricle's compromised pumping ability, causing rapid lung congestion. Patients with orthopnea often describe needing to sleep propped up on multiple pillows or in a reclining chair to breathe comfortably. Some people unconsciously adapt by gradually adding more pillows over time without realizing this represents a progression of their heart condition. The number of pillows needed often correlates with the severity of heart failure. Clinical studies indicate that orthopnea is present in approximately 65% of patients with moderate to severe heart failure. Unlike dyspnea on exertion, orthopnea represents a more advanced stage of the disease process. The symptom occurs because your compromised heart cannot handle the increased blood volume that occurs when lying flat. If you've noticed that you can only sleep comfortably when propped up, or if you wake up feeling like you're suffocating when lying flat, this is not normal. This symptom indicates that your heart is struggling significantly and requires immediate medical attention. Don't dismiss this as merely being more comfortable sleeping upright. It's a serious warning sign that demands evaluation. 3. Peripheral edema. Swelling of legs and ankles. Swelling in your feet, ankles, and lower legs, medically termed peripheral edema, is one of the most recognizable signs of heart failure, particularly when it affects the right side of your heart or represents advanced ventricular disease. This isn't temporary swelling from standing too long. It's persistent fluid accumulation that worsens over time. The American Heart Association explains that peripheral edema develops when your failing heart cannot pump blood forward effectively, causing increased pressure in your venous system. This elevated pressure forces fluid from your blood vessels into the surrounding tissues. Gravity pulls this excess fluid to the lowest parts of your body, typically your feet and ankles. Cardiac edema has distinctive characteristics that differentiate it from other causes of swelling. It typically starts in your feet and ankles, is usually symmetric, affecting both sides equally, and leaves an indentation when you press on it called pitting edema. The swelling often worsens throughout the day and may improve slightly after sleeping with your legs elevated. Clinical studies show that peripheral edema appears in approximately 75% of heart failure patients, usually emerging after exertional symptoms have already developed. The edema typically corresponds to New York Heart Association Class II or III disease indicating moderate heart failure. The severity of swelling often correlates with the degree of heart dysfunction. Monitor your ankles and feet daily, especially if you've noticed other symptoms like shortness of breath or fatigue. If you compress your finger into your ankle and it leaves an indentation that persists for several seconds, this suggests fluid retention. Weight gain accompanying the swelling further confirms fluid accumulation and requires immediate medical evaluation. 4. Persistent cough or wheezing. A chronic dry cough that persists despite treatment with cough suppressants or cold medications can be an early indicator of heart failure. This cardiac cough develops as fluid accumulates in your lungs, irritating the bronchial receptors and triggering the cough reflex. Unlike respiratory infections, this cough doesn't respond to typical treatments. The American Heart Association notes that this cough may occasionally produce pink frothy sputum which indicates severe pulmonary congestion. The pink coloration comes from small amounts of blood mixed with the fluid while the frothy appearance results from air mixing with the excess lung fluid. This specific type of sputum is a medical emergency. Wheezing can also accompany heart failure, particularly when fluid accumulation becomes significant. This cardiac wheezing differs from asthma-related wheezing because it doesn't respond to bronchodilator medications like albuterol. The wheezing occurs because excess fluid narrows the airways, creating turbulent airflow. Studies show about 70% of heart failure patients develop respiratory symptoms, with cough being an early sign. This cough often worsens when lying flat and improves when sitting up, mimicking orthopnea. While it's often mistaken for allergies, reflux, or medication effects, a persistent cough, especially with fatigue or shortness of breath, should prompt cardiac evaluation. 5. Fatigue and weakness. Overwhelming fatigue and weakness often represent the earliest symptoms of heart failure, yet they're frequently overlooked because they develop so gradually. This isn't the normal tiredness you feel after a long day. It's a profound exhaustion that interferes with daily activities and doesn't improve with rest. The physiological basis for cardiac fatigue involves reduced cardiac output, meaning your heart cannot pump enough oxygen-rich blood to meet your body's metabolic demands. Your muscles, brain, and organs receive inadequate oxygen and nutrients, resulting in the sensation of weakness and exhaustion. Research demonstrates that fatigue is present in approximately 90% of heart failure patients and often precedes other more obvious symptoms by months or years. According to the New York Heart Association classification, fatigue typically corresponds to class 2 heart failure, making it one of the earliest detectable symptoms. This early timing makes fatigue recognition crucial for preventing disease progression. The fatigue of heart failure has specific characteristics that distinguish it from normal tiredness. It tends to worsen throughout the day, doesn't improve significantly with rest, and interferes with routine activities. Patients often describe feeling like they're running on empty or having no energy reserves to draw upon. Many people attribute cardiac fatigue to aging, stress, or poor sleep delaying medical evaluation. However, if you've noticed a significant change in your energy levels that persists for weeks and affects your ability to perform normal activities, this warrants cardiac assessment. Early recognition of cardiac fatigue can lead to interventions that dramatically improve both energy levels and long-term prognosis. 6. Paroxysmal nocturnal dyspnea, PND. Paroxysmal nocturnal dyspnea represents one of the most frightening symptoms of heart failure. Sudden severe shortness of breath that awakens you from sleep, typically occurring 1 to 3 hours after falling asleep. These episodes can be terrifying, leaving patients gasping for air and sitting bolt upright to catch their breath. The Cleveland Clinic identifies PND as a classic sign of congestive heart failure, representing a late-stage symptom of left-sided heart disease. The timing of these episodes is crucial to understanding their cause. They occur when fluid that has accumulated in your legs and abdomen during the day redistributes to your lungs when you lie down. During sleep, your body's natural circadian rhythms cause changes in hormone levels that affect fluid balance. Additionally, the horizontal position allows gravity to redistribute fluid throughout your body. When your weakened left ventricle encounters this sudden fluid shift, it becomes acutely overwhelmed, causing rapid pulmonary congestion. Research indicates that PND episodes typically last 10 to 30 minutes and resolve when patients sit upright or stand up. The relief occurs because gravity helps drain some of the excess fluid from the lungs back into the systemic circulation. However, this temporary relief doesn't address the underlying heart failure that caused the episode. Sudden nighttime breathlessness PND is a medical emergency. Unlike sleep apnea or nightmares, it signals advanced heart failure. If you wake up gasping for air that eases when you sit up, seek immediate cardiac care. 7. Jugular venous distension, JVD. Jugular venous distension refers to the visible bulging of neck veins when you're positioned at a 45 degrees angle, indicating elevated pressure in your venous system. While this sign requires clinical examination to detect accurately, understanding its significance helps you recognize the severity of heart failure symptoms. The jugular veins act as a window into your heart's function because they directly connect to your right atrium. When your right ventricle fails or becomes overwhelmed, blood backs up into the venous system, causing these normally flat neck veins to become visibly engorged. This represents significant cardiac dysfunction and fluid overload. Medical literature from the National Center for Biotechnology Information identifies JVD as a classic sign of heart failure with high specificity, meaning when it's present, heart failure is very likely. Healthcare providers assess JVD by observing neck veins while you're positioned at various angles, looking for abnormal distension that indicates elevated central venous pressure. The hepatojugular reflux test accompanies JVD assessment where gentle pressure applied to your liver causes further neck vein distension in heart failure patients. This occurs because the failing heart cannot accommodate the additional blood volume displaced from the liver, causing immediate backup into the jugular veins. While you cannot reliably assess your own jugular veins, understanding this sign helps you appreciate the comprehensive evaluation your doctor performs. JVD typically appears in moderate to severe heart failure and indicates that your condition has progressed beyond early stages. If your healthcare provider mentions detecting JVD during examination, this signifies serious cardiac dysfunction requiring intensive treatment. 8. Pulmonary crackles, RS. Pulmonary crackles, also called RLS, are fine crackling or bubbling sounds heard through a stethoscope when you breathe in, typically at the bottom portions of your lungs. These sounds indicate that fluid has accumulated in your lungs' air sacs, alveoli, a condition called pulmonary edema resulting from left-sided heart failure. The crackling sound occurs when air passes through fluid-filled alveoli during inspiration, causing them to pop open. These sounds start at the lung bases because gravity causes fluid to accumulate in the lower portions of your lungs first. Pulmonary crackles represent a more advanced stage of heart failure, typically appearing in moderate to severe disease when significant fluid accumulation has occurred. Unlike other respiratory sounds such as wheezing, crackles specifically indicate fluid within the lung tissue itself rather than airway obstruction or inflammation. Crackles in the lungs reflect the severity of pulmonary congestion. Early in heart failure, they appear only at the lung bases with deep breaths, but as the condition worsens, they spread upward and can be heard even during normal breathing. Though you can't hear your own lungs, doctors listen closely for crackles. If present with shortness of breath or other symptoms, they signal significant heart dysfunction needing prompt care. 9. Third heart sound. S3 gallop. The third heart sound, medically known as an S3 gallop, is an extra heart sound that occurs immediately after the normal lube-dub of your heartbeat, creating a rhythm that sounds like a galloping horse. This additional sound is one of the most sensitive early indicators of heart failure, often detectable before other symptoms become apparent. Research from the National Center for Biotechnology Information demonstrates that an S3 gallop indicates increased filling pressures and volume overload in your heart's ventricles. The sound occurs during rapid ventricular filling when blood rushes into an already overfilled or stiffened heart chamber. This creates vibrations that produce the characteristic low-pitched sound. The S3 gallop has particular diagnostic significance because it can appear early in heart failure progression, sometimes before peripheral edema or severe shortness of breath develops. Healthcare providers consider it one of the most reliable physical findings for detecting heart failure with high sensitivity for identifying patients who will benefit from heart failure medications. The S3 sound occurs in early diastole during rapid ventricular filling. It suggests the heart is too weak or stiff to handle blood volume normally. Though you can't detect it yourself, an S3 gallop on exam signals early heart dysfunction, even without noticeable symptoms. 10. Rapid weight gain. Sudden weight gain of several pounds within days represents one of the most reliable early warning signs of worsening heart failure. This isn't gradual weight gain from changes in diet or activity. It's rapid fluid accumulation that can add 3 to 5 pounds or more in just a few days. The National Center for Biotechnology Information emphasizes that precise daily weight monitoring is a cornerstone of heart failure management because weight changes reflect fluid retention more accurately than subjective symptoms. Each pound of weight gain represents approximately 500 milliliters of retained fluid, making weight monitoring an objective measure of your condition. Healthcare providers typically recommend that heart failure patients weigh themselves at the same time each day, preferably first thing in the morning after urinating and before eating or drinking. A weight gain of 2 to 3 pounds in one day or 5 pounds in 1 week should prompt immediate medical contact as this indicates significant fluid retention. Rapid weight gain in heart failure happens because weak pumping causes the kidneys to retain sodium and water, increasing fluid volume. While this helps at first, it later strains the heart. Track your daily weight, know your baseline, and report sudden gains with swelling or shortness of breath to your provider. Early action can prevent complications and hospitalization. 11. Hepatomegaly, liver congestion. Hepatomegaly refers to liver enlargement that occurs when chronic right-sided heart failure causes blood to back up into your liver, making it swollen, tender, and firm to the touch. This represents advanced heart failure and indicates that your cardiovascular system can no longer maintain normal blood flow patterns. Your liver becomes engorged with blood similar to a sponge becoming saturated with water. This congestion interferes with normal liver function and causes physical discomfort. The enlarged liver often causes right upper quadrant abdominal pain or discomfort, particularly when you take deep breaths or lean forward. This pain differs from typical abdominal discomfort because it's related to the physical stretching of the liver capsule from internal congestion rather than digestive issues or muscle strain. Associated symptoms of hepatomegaly include poor appetite, nausea, and early satiety, feeling full quickly when eating. These occur because the enlarged liver presses against other abdominal organs and because liver congestion interferes with normal digestive processes. Some patients also notice their abdomen appears distended or their clothes fit tighter around the waist. Hepatomegaly typically appears in advanced heart failure, often accompanying other signs like severe peripheral edema and ascites. If you're experiencing unexplained right-sided abdominal pain, especially with other heart failure symptoms, this requires urgent evaluation. The presence of liver congestion indicates that your heart failure has progressed significantly and needs intensive medical management. 12. Ascites, abdominal fluid accumulation. Ascites represents the accumulation of fluid within your peritoneal cavity, the space between your abdominal wall and organs, and indicates late-stage right-sided or ventricular heart failure. This condition develops when severe venous congestion causes fluid to leak from blood vessels into your abdominal cavity. The increased venous pressure from severe heart failure forces fluid through blood vessel walls into body cavities, with the abdomen being a common location for this fluid accumulation. Patients with ascites typically notice progressive abdominal bloating that doesn't respond to dietary changes or gas relief medications. The fluid accumulation causes the abdomen to appear distended and feel heavy or uncomfortable. Unlike bloating from digestive issues, ascites causes persistent abdominal enlargement that worsens over time. Ascites and heart failure signal severe fluid overload and advanced cardiac dysfunction. It often appears with symptoms like leg swelling, liver enlargement, and shortness of breath. Patients may notice tight clothing, burly fullness, or trouble bending due to abdominal swelling. Persistent or worsening abdominal distension requires urgent medical attention to prevent serious complications. Don't wait for symptoms to worsen. If you notice these warning signs, contact your healthcare provider right away. Early care can prevent complications and help you live well with heart failure. Subscribe to the Human Health YouTube channel for more insights. If you found this content helpful, please like, share, and comment below.